Hello, everyone. Good evening, good afternoon, good morning, wherever you may be in the world. And thank you so much for joining us for another NDD Live webinar. This month is going to be just a little bit different. We are going to be talking about tackling COPD from awareness to action, kind of preemptively getting a jump on World COPD Day, which is next Wednesday, November 20th. We're just so excited for you guys to join us. I know that we always have quite a diverse group that comes in for our regular live training webinars. This is going to be a little bit different feel. We're going to be talking through a lot of statistics, a lot of facts and figures about COPD worldwide. So if you notice in your toolbar, there is actually a handout from this webinar that you are able to download to use later. Again, lots of numbers, lots of statistics. So we want to make sure that you have those if you are creating a awareness to action plan for your facility. We want to make sure that you have access to the presentation that we are sharing today. So that is there and available in the handout section of your toolbar. All right, just a few reminders before we get started. If you do have any questions that come up during the webinar, you can type them over into the question bar in your GoToWebinar toolbox. We're going to try to take some time to answer those, but again, this is a little bit different than our traditional live training on our products. So a lot of those questions, of course, still ask them, but I will be following up with those most likely via email once this presentation is over. As always, the webinar recording will be sent the next day. Anybody who has registered for the webinar, whether you're able to attend live or not, will receive an email from GoTo tomorrow with the video from this presentation. All right, and if for some reason that is misplaced or not watched in a certain amount of time, those webinar recordings are always available on our website at nddmed.com. All right, so what are the objectives for today? The first is to talk about the burden of COPD, both on patients and our healthcare providers. The second is to talk about the critical role that spirometry plays in diagnosing COPD. Third are going to be the common challenges clinicians face with spirometry testing. Next, exploring some practical strategies for overcoming spirometry testing barriers. And last but not least, World COPD Day, again, is next Wednesday, November 20th, and we're going to share just a quick sneak peek of a groundbreaking new spirometry solution from NDD. All right. So we are just so thrilled this year. The Gold COPD Initiative, their theme actually for COPD Day this year is to know your lung function. And I think that this is such just a timely presentation, just because, again, us being a spirometry company, us being advocates in this space, I think it's great that the Gold organization is really acknowledging the importance of people knowing their baseline lung function, especially in the treatment and management of COPD. Looking at some numbers, COPD by the numbers, more than 15 million Americans, or 6.4% of the general population, has reported to be diagnosed with COPD. COPD is the third leading cause of hospital readmissions in the United States. And again, a lot of these statistics are coming from the United States, but looking at a global picture, we know that this is going to be the same story no matter where you live in the world. All right, in 2021, COPD accounted for an estimated 138,000 deaths. And a 2024 study concluded that the total costs of COPD, so hospitalization, medications, treatments, therapies, all of that lumped into the overall direct costs for COPD in the US were 31.3 billion, and they project that this is going to grow upwards of 60 billion by the year 2029. So this is just showing us that COPD is not going to be going away. All right, looking at this spotlight on COPD, despite being one of the leading causes of death worldwide, COPD, or chronic obstructive pulmonary disease, is underdiagnosed and underprioritized within the healthcare system. The diagnosis of COPD should be confirmed by spirometry, and this confirms that presence of poorly reversible airflow limitation, that destructive part of the disease. However, results from a database study of more than 5,000 patients reported that only 1/3 of those people with a suspicion for COPD have actually undergone spirometry. So a little bit of a mismatch here. To ensure a timely and accurate diagnosis, spirometry should be performed in the primary care setting. This is where patients are always going to present earliest with their symptoms. I always kind of say COPD is one of those diseases that until someone is symptomatic for an extended period of time, a lot of times we don't go looking and investigating farther into this patient's care. Lots of things can cause cough, lots of things can cause shortness of breath. And I really do feel that there's a disconnect starting in that primary care space of, okay, when is the appropriate time to perform spirometry, identify that obstruction, and start this patient on a treatment plan. So many times symptomatic patients don't see a spirometer until they have had months and months of complaints with their primary care, and then wait months and months farther to get into a pulmonary or an allergy doctor. So the importance of early diagnosis. We know that COPD is progressive. We know that it gets worse and worse as the patient goes on. So what are the importances of early diagnosis is using spirometry, again, focusing in that primary care space. The first, like I just mentioned, COPD is often diagnosed way late stage when significant lung damage has already occurred. Again, we have months and months of symptoms, months and months of primary care visits before action is a lot of times taken to get them to the correct specialist. Early detection of this airflow obstruction with spirometry, that early diagnosis of COPD, allows for lifestyle changes. Effective management can lead to improved patient outcomes. So lifestyle changes, a patient could stop smoking. A patient could start exercising and managing their diet and their weight. We could start them on controller medications earlier so that we are taking control of these symptoms from the very beginning. And again, another important reason why we need to have an earlier diagnosis is to reduce risk of further complications, hospitalizations for those exacerbation of disease, and decrease those healthcare costs. All right. We saw a couple of slides back that only 1/3 of these patients that are symptomatic actually get spirometry kind of from the get-go. And a lot of that, as I'm sure many of you know on this call, are due to some challenges that people face with spirometry. I always say that I wish it was like an EKG where we could just put stickers on our patient and it would say, bam, you have an airway obstruction. But we know that this is a patient-dependent test. We know that this is a coach-dependent test. We're eliciting such a specific behavior from these patients so that we can see if there is a problem or if there is not. So what are the primary challenges with spirometry? Again, looking through the lens of primary care, kind of those first people to lay eyes on a symptomatic patient, lack of access to spirometry devices. A lot of primary care doctors do not have spirometers and do not have staff that is trained to use them appropriately. Again, coming into that next session, lack of training. Again, this is a patient-dependent effort and a coach-dependent test. So that lack of training in the primary care space where you're typically not going to see your RNs and your RTs at bedside. Lack of training is a huge challenge for spirometry in primary care. Another issue, and this is on the bedside and on the physician level as well, is lack of understanding these results. Spirometry interpretation is kind of a confusing thing. We know that there are multiple ways to look at a patient test to determine what is normal for this patient based on their demographics. We also know that there are lots of different ways to interpret spirometry results, lots of different schools of thought, different set interpretation standards. So when you're kind of coming to it with just a baseline knowledge, like in primary care, sometimes the results can be a little bit overwhelming because there are so many different options of how to interpret these tests. And then last but not least on this side, again, the primary care is normally not those offices where we have our specialized RNs and our RTs. And so time turning those patients in one at a time all day long, and then consistent staff turnover. Even if we can fix lack of training, sometimes once we get an MA or a nurse's assistant trained, a lot of times these are high turnover positions. So sometimes the knowledge base leaves when a certain employee leaves the building. All right, spirometry. So the gold standard for COPD diagnosis. Why does spirometry really matter? We've heard about all of the struggles. We've heard about some of the issues of why spirometry in that first level of care is difficult, but why does it still matter, even with all of our struggles? All right, many patients with COPD remain undiagnosed. They just have a chronic cough, or they have shortness of breath with exercise. And an actual diagnosis of COPD is never determined because of the lack of spirometry testing. Spirometry can also help differentiate between our asthma and our COPD patients. So again, making sure that they are on the right treatment plans. And then again, enable staging of the disease severity so that we can tackle those treatment plans on a patient by patient basis. So a patient with severe airflow obstruction is obviously going to jump into a different plan than someone that just has a mild obstruction. All right, so us as providers, us as clinicians, what can we do? We can try to increase access to spirometry. We can try to make our devices as easy as possible and make them accessible at every level of care, offering portable, PC-connected spirometry solutions that are easily integrated into a primary care practice workflow. Right? We can improve education and awareness of spirometry as a diagnostic tool, just like all of you guys are doing today. Again, this might not be new information for a lot of us on the call, but I think a lot of times it really is shocking when you think to how many people are floating around out there with symptoms to COPD that are not being treated and have never had a spirometry test or a diagnostic test. We need to work to improve the education and awareness as spirometry is a diagnostic tool. So advocating for it at all levels of care. Educate on when spirometry should be performed and how often it should be performed. And emphasize again that spirometry really is the standard for a diagnosis of COPD. All right, again, expanding spirometry training. For the last year, we have gotten, some of us have got on together every month to focus on a different NDD spirometer, really learning how to perform tests that are acceptable, that are reproducible, and that we can really use as that diagnostic tool. So making sure that we are participating in hands-on or virtual webinars, understanding spirometry equipment, and also having our providers seeking information on how to interpret the results. Clear guidance on how to prepare a patient for a test and how to conduct an effective and successful spirometry maneuver. All right. You know, we really are all kind of in this together. My background is respiratory therapy. I'm a respiratory therapist. And again, this is something that is really near and dear to my heart. I myself am an asthmatic, so I'm very familiar with some of the same similar symptoms that COPD patients go through. My father also has COPD, and watching him throughout his disease journey has been really valuable and interesting to me to see the different steps that he has gone through in his plan of care. And also as a bedside clinician, being able to try to get these patients on the best plan to manage their disease moving forward. All right, I'll move my toolbar over just a little bit here. So we know that COPD presents a significant health challenge that affects millions of people globally. But early diagnosis through spirometry can greatly improve these outcomes. This COPD Awareness Month in November of 2024, join NDD in spreading the word about the importance of lung health and early diagnosis. Let's work together to ensure that more people understand the impact of COPD and the critical role spirometry does play in catching it early. All right. The need for a new spirometry solution really is clear. And again, we are really excited to partner alongside clinicians, especially at the primary care level, and try to equip them with the easiest solution possible to be able to make spirometry accessible and easy for these nurses and medical assistants, nurses, aides, whoever is working in that first line of care. Right. We did promise a tiny sneak peek of what we are going to be announcing next Wednesday on World COPD Day, but just a few teasers. What if spirometry could be easier than ever before? What is the future of spirometry going to look like? We know the importance. We know it needs to be in that first level of care, that primary care space. But what does that look like? All right, a little sneak peek there of someone that you're going to be seeing a lot of next Wednesday on World COPD Day. So stay tuned for our big product reveal next week. All right, another little sneak peek here. A breakthrough in spirometry is just around the corner. So again, stay with us next week for World COPD Day for our big announcement. We want to thank you guys so much for joining us today. Again, I know this is a little bit different webinar format than you guys are used to seeing when you hop on, but we felt like as a spirometry manufacturer, it was really our job to bring some awareness to this world issue of that underdiagnosed COPD patient. We want to advocate for that patient, and we want to advocate for our first line providers and make sure that they have the tools that they need, the training that they need, so that they can get these patients on the correct diagnostic path to make their quality of life just so much better. We want to thank you guys so much for joining today. And again, just because of the little bit different format of this webinar, I am going to take any questions that you guys have typed in, and I'm going to follow up with you guys as soon as the webinar has completed. But again, thank you guys so much for joining us. We're excited to share what we've been working on as a solution for primary care next week. Once that big reveal has happened next Wednesday, stay tuned, because it might give you a sneak peek of what our live training webinar in December is going to be focused on. Have a wonderful rest of your day, rest of your evening, wherever you may be in the world, and stay tuned next Wednesday for our big announcement, and we will see you on another NDD live webinar soon. Thank you so much, everyone, and have a fantastic day.